Mental illness and substance use anti-stigma discrimination intervention for primary healthcare providers in Ontario. Ending stigma starts with you. Starting in 2010, the Office of Transformative Global Health at CAMH developed an anti-stigma, anti-discrimination intervention in collaboration with 3 community health centers in Ontario. Now, this was based on previous experience that we had gained locally and abroad, where we found that decreasing stigma among primary healthcare providers is a cost-effective way to increase accessibility as well as the quality of care. As a result, we developed a comprehensive anti-stigma intervention for primary healthcare providers because typically they're the first point of contact for vulnerable populations. We're now in the process of implementing and testing this intervention. What is the problem? Mental illness and substance use issues are strongly associated with stigma. People with mental illness and substance use issues are stigmatized by the general public, but also within the primary healthcare system. What is stigma? Stigma is an attribute that is deeply discrediting. It reduces someone from a whole and usual person to a tainted, discounted one. Stigma basically refers to negative attitudes and beliefs. What is discrimination? Discrimination is a prejudicial act that is the result of stigma. It can be an intentional or an unintentional act. Discrimination is a major obstacle for people with mental illness and substance use issues. Discrimination can lead to problems finding employment and housing, an increase in social isolation, a decrease in the chance of individuals suffering from mental illness from seeking help. Did experiences of stigma deter you from seeking help?
I think so. I think I was trying to work it out myself. I was going back to my rooming house where I had really little support and barricading myself in my room and just lying down and trying to organize my disordered thinking myself, because I felt there was something that I could handle. And when I did reach out to the medical community, sometimes I met stressed people, just the nature of it, and we were both getting stressed.
How are you stigmatized?
I think there was a situation that lent itself to stigma. I was coming to a hospital emergency room and presenting my experience that I had this fixed idea, and I think they were trying to understand, but they were, whatever was going on with them at that moment, they crossed their arms, and that wasn't very helpful. That was sort of a separating type of behavior, and they seemed to be more stressed and criticizing my behavior rather than providing a health service.
Where did the idea for the project come from?
The drive behind this project is the discovery in our Latin American projects, Latin American collaborations with primary healthcare centers, that one of the most cost-effective ways to improve care at the community health center level was to reduce stigma. And from that learning, principally in Chile, we sought to transfer some of the knowledge and experience that we had gained to our local reality.
Why focus on healthcare providers at CHCs? Primary healthcare is often the first point of contact for vulnerable populations. Primary healthcare providers are unique because they can act as both stigmatizers and destigmatizers for people with mental illness and substance use issues. There are few studies aimed at reducing stigma among healthcare providers. What is a community health center?
A CHC for me is a place that understands primary health care as rooted in the social determinants of health. So we understand that wellness and health isn't about just being absence of disease. It's about healthy communities, and we try to work from that perspective. So we have not only medical services, but a wide range of services that also address other social needs of the community.
Who accesses the services at CHCs?
We work primarily with people who are living in poverty. We work with a lot of clients who are here that don't have paperwork so that they can't access traditional medical services. They don't have help. We work with a lot of single mothers, a lot of youth, a wide diversity of people in terms of their racial backgrounds, cultural backgrounds. But I would say the one thing that's predominant is that we predominantly work with people who are living in poverty.
In Ontario, primary health care is provided by community health centers, or CHCs. We decided to focus on CHCs because vulnerable populations, such as people with mental illness or addictions issues, are more likely to seek help from CHCs. Our aim is to improve care by reducing stigma and creating environments that support healthcare professionals in providing non-stigmatizing services. Where did funding for the project come from?
Funding for the project involves some funds from the Centre for Addiction and Mental Health, as well as Opening Minds, the Canadian Mental Health Commission.
Who were the partners that were involved?
In Ontario and Toronto, it's been principally community health centres. South Riveredale, Central Toronto, and Unison Community Health Centre.
The intervention consists of 6 components. The first component concerns developing teams of leaders made up of staff, consumer survivors, and community members. Component 2 is innovative contact-based education, where consumer survivors play a key role in facilitating workshops for primary healthcare providers. Number 3 is raising awareness, which consists of using various media to raise the profile of stigma and discrimination, as well as showcase recovery. Number 4, Recovery-Based Arts, is a contact-based workshop series where consumer survivors collaborate with providers to produce art pieces. Number 5 analyzes internal policies and procedures in order to identify strengths and areas for improvement in service delivery. Number 6 is a context-specific innovation, where each CHC identifies an area they would like to intensify efforts in. Ending stigma starts with you.